Indian Health. Oh, thank you so much, Jordan. I just jumped in. But thank you so much for coming and joining us today for our Community Grants Program Sweetgrass Pre-application Webinar. So here is our agenda for our presentation today. We're going to begin with some words of welcome, an introduction of our team, and then we're going to do an overview of the Community Grants Program. We'll talk about the current funding opportunity. We're sharing the application logistics, important dates and contacts for technical assistance. And then at the end, we'll have some time. If you have any questions, we can answer them during that time. So if you have any questions during the presentation, feel free to type them in the chat. Like I said earlier, my screen is full of the presentation. I can't really see the Zoom chat feature, but Jordan, my teammate, is here, so she'll be assisting with that. So without further ado, we want to welcome you all for attending the webinar today, or for viewing this recording at a later date. At UIHI, we always want to begin in a good way, making sure to come to this work with the right intentions, the right mindset. And I just want to share that I'm so thankful to get to connect with you and appreciate all the work that you do in our urban American Indian and Alaska Native communities. So we'll start off by introducing ourselves. So we are the management team for the Sweetgrass Grants. My name is Michaela Sakurai. I am Navajo and Palauan. I am originally from Phoenix, Arizona. My family is from Sawmill, and I use she, her pronouns. I'm a program manager 1 at Urban Indian Health Institute. I oversee our branch initiative. It stands for Building Resiliency and Action to Nurture Community Health. And it focuses on building public health infrastructure. And one of the ways we do that is through funding these Sweetgrass grants. So I'm going to go ahead and pass this over to Jordan to introduce herself.
Right. Hello, my name is Jordan Boabin. I'm a project associate 1 here at Urban Indian Health Institute, and I'm Chippewa, Cree, and Blackfeet, and an enrolled member of the Little Shell tribe out of Montana, but I'm originally from Southern California. And here at UIHI, my primary projects are with GWIC and Branch, so Good Health and Wellness in Indian Country, and then along with Branch, the webinar we're having right now. And I use she, they pronouns.
Thank you so much, Jordan. So Jordan and I will be main contacts for the Sweetgrass grantees for administrative needs. So next is our evaluation team led by our Public Health Associate Officer, Dr. Rose James. Dr. Rose James is Lummi and Duwamish. She has over 20 years of experience working in Native communities to improve health and well-being of Native people. In her role with the Community Grants Program, she meets with our grantees. She works on facilitating partnerships, and she also provides technical assistance. Our evaluation team is unfortunately unable to join us for today, but we do want to introduce you to them. So our main evaluator for the branch initiative is Paige Holsey. Paige is a non-Indigenous white settler from Coast Miwok Territory in California's Bay Area. She's a proud member of our UIHI Indigenous Evaluation Team, and she's been with us for a year. She brings her extensive training and lived experience to serve for Native populations. So now that we've done like an introduction of our team, we want to go ahead and provide an overview of our Community Grants Program. So the purpose of our Community Grants Program is to address chronic disease within urban Native populations. Our goal is to showcase through data the brilliance and creativity of the organizations we work with, and in this way live up to our mission of decolonizing data for Indigenous people by Indigenous people. Our objective with the Community Grants Program is to encourage the use of traditional, cultural, and regional knowledge in the development, implementation, and support of chronic disease prevention efforts. So we understand that Native people have solutions and answers to address chronic disease within their own communities. And through our Community Grants Program, we want to honor that knowledge. The Urban Indian Health Institute wants to continue to collaborate with urban Native serving organizations to reclaim our values of data evaluation and research, all with the aim of strengthening our public health capacity, addressing health disparities, and promoting health resilience in our urban Indian communities. So moving forward on our agenda, we're excited to share more about our current funding opportunity, the Sweetgrass Grants. In previous years, the Sweetgrass Grants have had a specific chronic disease focus, such as cancer or diabetes. For this fiscal year of 2022 to 2023, we are open to programming that addresses all chronic diseases. So the Sweetgrass Grant period will be December 16th, 2022 to September 29th, 2023. In this grant cycle, these funds will focus on Indigenous approaches to obesity prevention, commercial tobacco use prevention and cessation, type 2 diabetes prevention, heart disease and stroke prevention, but we're not limited to those things. As we said, it's overall chronic disease. So if you're interested in seeing examples of chronic disease programming of previous Sweetgrass grantees, we really encourage you to check out our Community Grants Program story map on our UIHI website. Jordan will go ahead and share that link in the chat if you would like to go ahead and look at that later on. So our grantees receive awards of $10,000. We do have up to 4 Sweetgrass grantees that we will award this fiscal year. And all applications can be sent to me at this email address, michaelas@uihi.org. Don't worry about writing it down right now or screenshotting it. It will be on our website, so you'll be able to find it later on. So now we'll talk about who is eligible for this funding. This information is also on our website. To be eligible for the funding, that your organization must be one of the following. So an urban Indian organization, a Title V program as defined by the Indian Health Service, or a member of the National Urban Indian Family Coalition, NUIFC, or an urban Indian organization or program receiving SASP DVP, formerly now MSPI DVPI funding as defined by Indian Health Service, and or lastly, a not-for-profit urban Indian organization whose leadership and board are made up of a majority of urban Indians. So if you have questions about your organization's eligibility for this funding, please feel free to email me and we can work through determining eligibility together. Funding restrictions. There are some funding restrictions with this application. They do remain the same year to year. So recipients may not use funds for research, for clinical care, nor to purchase furniture, equipment, or clinic patient supplies. The recipients may use funds only for reasonable project purposes, which can include travel, supplies, personnel, and services. Salaries, if requested, are restricted to project activities. So they must be used for this project, and it can't be used outside of the project unless otherwise approved by UIHI or Urban Indian Health Institute. this would be kind of a rare occurrence, but we do determine those on a case-by-case basis. So the components for the application are as follows and can be located on our Sweetgrass Grants webpage. Submission will include a completed application form, a completed work plan, and a completed budget worksheet and justification. These application components can be sent to me electronically by the due date. We will also have this information available on our webpage. So we do want to share factors that we consider in our decision-making process. First, our management team will put together a committee to review the Sweetgrass applications. And the application review committee looks at geographic diversity. We look at program innovation. We look at, does your program serve a wide range of age groups? And is your organization committed to collaboration and partnership to advance urban Indian health and well-being? We also want to share an example of the kind of justification we are looking for in your budget worksheet. So as you can see, each line item has a clear justification. So for an example, if you're looking to bring on a fitness instructor as a consultant, one time per week for 30 weeks at $100 per session equals $3,000. That's a very clear justification. Same thing goes for any of the line items, is just provide a very clear justification of what you're requesting in your budget. We also ask to make sure to include direct costs, total direct costs. If you're including an indirect cost, just remember to include it as a rate. And indirect cost is permissible to include on your budget, but it is optional also. So if you would like to, you can just keep that at 0. But at the end, this budget would need to have your direct costs plus your indirect costs equal your total for your contract, which for Sweetgrass grants would be $10,000. So if you do have any questions about this budget work plan, you can feel free to email me again. I'm very glad to help. We also do have, if you're looking for a resource for developing a budget and preparing a budget, the CDC has a guidelines fact sheet online, and we can share that in the chat as well. That might be useful. As stated earlier, the process for selection is through committee review. So we use a 3-phase equitable grant making framework to increase transparency using a group consensus-based decision-making process. So in our 3 phases, we have our first phase. We look at an initial screening of our applications. We look at whether the applicants are eligible for the funding and if all of the application components have been submitted on time. In the second phase, we conduct an in-depth review of applications, work plans, and budgets. We offer comments and questions in the form of technical review. So we want to be able to provide feedback to applicants to make sure that there's transparency in our process, but also as an opportunity to learn from the process. In our third phase, the review committee meets with our UIH, our Urban Indian Health Institute leadership, to conduct consensus-based decision-making. So all members of this group must agree on the selected applicants. So no decisions are made lightly or without approval of our Urban Indian Health Institute leadership. Once decisions have been made, we send our selections to the CDC for written approval. This process can take time, so we do ask for some patience while we wait for approval. The projected date for announcing our 2022 to 2023 grantees is December 16th, 2022. critical date to note is the application due date is Monday, November 21st, 2022 by 11:59 p.m. and that is Pacific Standard Time. Any technical assistance requests concerning Sweetgrass grants can be directed to me, Michaela Sakurai, through email. Our project award timeline is as follows for the Sweetgrass grants for this fiscal year. So Tuesday, October 11th, last week, we released our request for applications to our community partners. We today are hosting our pre-application webinar, and November 21st, applications for funding are due by 11:59 p.m. On December 16th, subject to CDC approval, we will announce funding recipients. And then our grant period will be December 16th, 2022 to September 29th, 2023. So thank you so much for listening to our presentation. And at this time, we're just going to see if anybody has any questions for us. Oh, I see chat. Oh, thank you. Thank you, Jordan. I don't hear any questions. You can definitely feel free to put them in the chat, put them in, or raise your hand. Or later on, if you do think of a question later on, you can always email and we can get back to you then as well. Sounds good. So thank you so much for joining us today, this Monday morning. I hope you really have a great week. And I really hope to get to see some of your applications for this grant. And please reach out if you have any questions.